traveled quite a distance to be a part of this conversation. So thank you for being here and bringing your time and perspective into this space. As we come together for this session, we're not talking about heat as just a climate issue. Hello. Yeah. We're not talking about heat just as a climate issue. We are really talking about how heat is experienced, especially by those who work and whose daily lives are exposed to it. If we step back and look at the scale of the issue, India is already seeing some of the most significant impacts of extreme heat. Nearly 3/4 of the workforce is exposed to high heat conditions. More than 90% of India's workforce is informal. This includes not just outdoor workers, but also a large number of indoor and home-based workers, particularly women, whose exposure remains largely invisible in data, policy, and protection systems. That is why the session is titled Invisible Exposure. Heat today is just not about temperature, it is a health issue. It is about physiological stress, fatigue, dehydration, dizziness, reduced productivity, and in many cases, long-term health risks. When we say rethinking heat metrics as a byline to this session title, we are really asking a very basic question. Do the indicators we rely on today actually capture how heat is experienced? It is also shaped by where and how people live and work by built environments, housing conditions, access to ventilation and cooling. At the same time, we are seeing the rapid growth of gig work, a workforce that is highly exposed, often working under algorithm-driven pressures with very limited social protection. Even policy responses are emerging, such as advisories for gig workers through NDMA. These are largely non-binding and not embedded within the enforceable labor or safety frameworks. As a result, occupational heat risk continues to be underestimated. And then we talk about protection pathways in this session. The question is, once we understand how heat is experienced, are the systems we have in place today really protecting the workers? And if not, how do we begin to think about it differently? This session will look at the gap between how heat is measured, what workers actually experience, and how the systems respond. We will move from heat metrics to emerging evidence, then to lived experiences of informal and gig workers, and finally reflect on what this means for labor, health, and built environment systems. This will be an open discussion. There will be an open discussion. Your perspectives and experiences are important in helping us to understand how evidence can translate into action. Lastly, if there's one thing to keep in mind as we begin, it is this: if we continue to measure heat the way we do today, we will continue to underestimate the risk. And if we underestimate the risk, we will continue to under-respond. With that, I'd like to invite Dr. Bhargav Krishna from Sustainable Futures Collaborative to open the discussion. Thank you, and I look forward to a very engaging session today.
Folks, in this room, there are people who understand the key issues that heat has on workers, right? Like, we've established that. Let's start off as that is a given and really try and leave from here with some kind of a roadmap for where the gaps are, what are the things we should be working on in research, in policy, at the various institutions that we're in. There's, again, a wide range of disciplines that is present here, which is very encouraging. I see Rushika Lal, Vidya Venugopal, Sheikh Salahuddin. These can't be, more different vantage points. So it's really very encouraging that this is a group that has assembled. The last time we had a similar panel a year ago, I want to hazard a guess that there were about half the number of people for a theme like this. And so it's very encouraging that this is very much now in everyone's consciousness. Very quick run of the program so that we don't stay here till 7 p.m. Because Sujata ma'am said, 6:30 is the cutoff. And so here is what I suggest. Dr. Bhargav Krishna and I are just going to present some research findings as a prompt to get the discussion going. Professor Khosla will then lead a discussion with Dr. Vidya Venugopal, Dr. Yogi, Dr. Sahil Hebar, responding to some of what has been presented. We will then open it up for discussants. I'm just going to list out the discussants in a second as well. We then have a presentation by Apekshita, followed by in a similar format, so a presentation by Apekshita, followed by a discussion with Dr. Adele and Sheikh Salah Ganji, and then open up for discussants again. Here is what I propose. The list of discussants, and those whose names are not listed are, obviously very, very welcome to talk. The discussants are so that we can seed the conversation and have things to respond to. But this is a very large room, and I'm hoping everyone speaks up. The discussants have been organized in the following way. I'm just saying, for home-based and informal work, the names I have are Arvind Doni, Ruchika Lal, Purvi Patel, and Sandol Yasovant. And for the gig economy, it's Tamanna Dalal, Suma, CG Chako, and Arvind Doni again, right? So there are some repeated names. Why don't we just see how the panel proceeds? It may make sense to just finish the presentations, have the panel discussion, and have a good, 40 minutes, 45 minutes at the end for the discussants to talk across gig and informal, because they aren't, this distinction is a little bit legal, but the human physiological impacts and what we're going to talk about, the precarity of workers' rights is all cross-cutting. So if you're okay with that, if someone feels very strongly that they must discuss, before we move to the next session, just chime in, right? This is a friendly space. Let's get down to business. I invite Dr. Bhargav Krishna to share his findings.
Thank you, Sachit, and thank you, Ritika, for putting together this panel. This is a little bit zoomed out from the conversation that we're going to dive into a little bit further in the session. But I was asked to sort of present some of the newer research that we've been carrying out together with colleagues at Harvard, and to also sort of use that as a conversation starter about how we are looking at metrics with respect to threshold temperatures, physiology, health impacts, and how can that better inform our policy conversations. So just very quick context, everybody already knows this. This is an audience that is well acquainted with this, of course, but basically we are in a serious situation with respect to heat risk now and going forward. And we need to figure out how better to manage this risk, not just in the future, but now as well. And the question is largely around how can the epidemiological work, the health science work that we do better enable our understanding of how to target interventions as well as when to intervene as the state to advise citizens on measures to protect themselves, but also when things like heat action plan measures need to kick in at a city level or at a state level. When does the state respond with respect to heat, right? The way that it currently works is you declare heat wave alerts to manage heat risk, right? So either based on sort of exceedance from historical temperature trends or on breaching specific temperature thresholds based on location. So that could be 40 degrees in plains areas, 38 degrees in coastal areas, or 35 degrees in mountainous areas. Or if you have consecutive days of high heat, a heat wave is declared, or some combination of all of these things, right? Generally, in practice, what we've seen is that if temperatures breach 40 degrees anywhere, a heat wave is declared, right? And so we can see from the IMD heat wave map as on this today, that there are parts of India where it is already severe heat being experienced. Now, the question that we kind of started out with is, are these numbers really satisfactory in protecting our population more broadly, but also specific vulnerable groups that might be affected by heat exposure? The way that previous studies have tried to approach this is by looking at whether percentile-based thresholds would work. So you look at the last 30 years of historical temperature data, determine that the 98th or 99th percentile is considered extreme heat, or if you want to be more conservative, anything above the 95th percentile should be considered extreme heat exposure. Use that as the cutoff and then determine that a heat wave should be declared based on that. Now, we wanted to approach that question to see if that was the best way to do it, or if there's some other way that we could explore this particular question. Now, I'll caveat this, of course, that this is early findings that have not been published yet, so this isn't for citation, just for conversation within this room at this point in time. But essentially what we did was we used a slightly different approach and developed an excess mortality model that accounted for all-cause mortality in 5 cities around India essentially trying to understand where mortality starts to rise as a result of temperature in all of these cities. And the durations varied. It was between 5 years and 10 years of data across each one of these cities. And what we found was that there was distinctions between where mortality started increasing and where existing heat wave declaration thresholds were. So in this particular chart, if you look at the legend, what we have is we've sort of delineated where the current IMD threshold is for these cities, as well as where the historic temperature trend based 97.5 percentile temperature is. And in almost all of these cases, where mortality starts rising is well below that, right? So what we see is that's particularly salient in cities that are further away, or that, like in Ahmedabad and in Kolkata, for instance, where mortality starts rising a lot before where thresholds are being declared. In places like Chennai and Mumbai, it's probably a lot closer together. So what we also saw in this is that there is a lot of variation between cities, determined either by geographic location, the type of weather that you experience, the type of heat that you experience, demographic profiles. Lots of these things may be varying how people are experiencing heat and how they're dying from it. And this essentially also makes the case for doing this in a much more localized manner and not in a sort of standardized format where you have the same threshold across multiple different parts of the country. The second aspect of this is, okay, now we know that mortality begins a lot earlier than we had originally thought. What can we do with that kind of information? So what we saw then was we quantify the number of deaths that are occurring in each one of these cities over the course of the study period and try to understand how much of that happens as risk increases by 0 to 5% or by 5 to 10% or greater than 10%. And on the left-hand side column, you can see the temperature buckets that falls within as well. So if you were to take Ahmedabad, for instance, the increase in relative risk of 5% is below 39 degrees, right? 39 degrees Celsius. So that's currently below where a heat wave would be declared. But you still have about 1,300 odd deaths, 1,250 deaths that are occurring during that particular time frame. In Delhi, for instance, that similar bucket is just about touching the 40-degree heat wave threshold. You have about 960 deaths occurring. Now, the interesting part is how do we think about when to declare a heat wave? Is it sufficient that any excess deaths are occurring, or is it a significant number that should have occurred for us to be thinking about that as much more serious? So Kolkata and Mumbai are interesting examples here, where in other cities, there's a sort of gradual increase from a low to high number. In Kolkata and Mumbai, what we're seeing is a much more clustered number of deaths that are occurring at lower temperatures, and it's sort of tapering off towards higher temperatures. So each city has its own set of characteristics that we need to prepare for as we're developing our heat action plans and our response measures that need to be built into the health system. Right? So the uniform temperature, and for both of these, Kolkata, Mumbai, Chennai, all of them have the same threshold right now for heat wave declaration. They don't all look the same when it comes to how people are dying in these cities, right? So this is sort of one of the key takeaways that we got from this as well. Now, how does this compare to past work? So there's a study that I was involved with, as were several others, published in 2024, looking at 10 cities around the country and how excess deaths were occurring as a result of heat. And using the 97th percentile threshold approach, we determined that there are about 1,100 excess heat deaths every year. This particular approach that we are using, the lower threshold, so the 95th percentile matches closely with how we are looking at our results. So there's a relative consistency in approach, but the question is whether we are setting our thresholds too high. Humidity is an interesting aspect within this. So in our particular study, introducing humidity as an explanatory variable had really no effect modification at all. So it didn't really affect how people were dying, except in cities where humidity is not a perennial phenomenon. So in cities where humidity is a seasonal problem, so cities where there may be the monsoon, for instance, Ahmedabad and Delhi, humidity was a significant effect modifier, but not in places where you have humidity throughout the year. Now the question for us is, how can we set thresholds that matter? If we declare a heat wave every time temperatures reach 35 degrees Celsius, for instance, nobody is going to take it seriously. So I guess the question is, how do we balance prudence with the importance of saving lives when we're deciding on these important metrics that determine how our systems respond? So I'll leave you with that. Thank you.
Thank you. Thank you. You know, it's the first panelist that ended on time. I'll share the findings from the SEVA studies as soon as the slides are loaded. A little background. Some of you have heard about this study. For others, it might be the first. So the Self-Employed Women's Association, that needs no introduction, a membership of now nearly 4 million women across the informal economy in India, comprising street vendors, construction workers, salt pan workers, ship breakers, waste recyclers, and on and on and on, right? Home-based artisans, working indoors, working outdoors, in physically arduous manual labor, some not that physically arduous, but all poor, and all members of SEVA. You heard me this morning talk about the parametric heat insurance and the questions that they raised, and that was essentially the genesis of this study. What we realized were a couple of things, right? The big science gaps we felt were that when we look at our apps, when we look at weather station data, when we look at IMD data, we're largely looking at the weather stations that the Brits left behind and a few thousand more across India, and then maybe remotely sensed temperatures more recently via the satellites, right? And that's sort of how we are averaging what surface temperature is like. The lived environments of the poor are very, very different at home and at workplaces. It's much hotter. That was the hypothesis. We sent a student running around with little micro sensors to see if there was a difference, and we found that there was often a 10-degree difference between the outdoor temperature and the home temperature, which has huge ramifications on all the heat action plans that we are busy generating, 300 of them that we're going to create, right? What is the threshold going to be, including, the findings that Bhargav shared with. So that was one, right? How do you downscale this? We've talked about urban heat index. The gentleman in the previous panel essentially talked about localization as well. And then the other was this question of, well, how hot is too hot, and for what? Too hot for my child to sleep, too hot for me to continue working, too hot for my wages to remain stable, too hot for my heart to not become tachycardic, too hot for my kidney to not fail. What are we measuring? How are we measuring? A lot of a conversation around heat is wrapped up in mortality. 3 days of heat wave, so many people died. Between the impact of extreme heat and mortality are millions of people that are living in absolute misery. And this is not an audience that needs this point belabored. It's hot enough for us. Imagine what it is without the resources we have, right? So the conversation needs to shift from mortality to human flourishing, right? Which is not what you hear in the heat conversations at all. We are not talking about what will it take for folks to continue to live a life of dignity, however limited their lives may be. I'm pushing through these slides because I don't want to preach to the choir. You all have seen all this, right? So let's just get to the study findings. So the study is organized as following. There is, I'll pause on this, for example. As we began to sort of understand what is going wrong and why do we not know all of this, we said surely in the literature we must have answers. We looked about 2,000 articles and whittled down to about 600 and found that a lot of the information that is being produced is actually coming from 3 or 4 networks around the world. And I won't sort of get into which and why, but this has to do with money and industry and interest in this. A lot of the heat literature actually does come from India and Iran, and much of the Indian literature actually does come from this brilliant professor to my left, from whom you will hear in a minute, right? So it's actually very influential work that has come from her shop. We found that there is not enough representation of women. A lot of these studies were done in men. It is certainly not in the informal sector. It's mostly in the formal sector. It's all wrapped up in occupational health and rules and regulations, none of which are easy to, there are no mechanisms to actually apply that to the informal sector. And the gig economy is a complete scam, right? It's an erosion of workers' rights, by calling them partners or whatever, right? And that is a conversation to have, rather than treat it as if, I think we give it legitimacy by treating it as a separate category of work. This is a made-up category by platform organizations that want to take worker rights away from workers. And so the way this has been designed is that the Self-Employed Women's Association leads this project. A bunch of researchers at Harvard, when they can make it here, provide technical assistance. Over 800 women are wearing wearables 24/7 for 13 months each, all right? And they are equipping their microenvironments at work and home with sensors, temperature and humidity sensors, all right? So it's about 9.5 million hours of 9.5 million person hours of data that will be collected, making it the largest data set in the world, entirely managed, co-created, implemented, evaluated, monitored by the Seva women. All right. There are a few different sort of architectural components to it, which I will skip over in the interest of time. But essentially, you see that there are devices. There is a significant backend architecture. Imagine, all these women spread across India. You're collecting data from their wearables and from their microsensors, etc. There are monitoring teams. So there's some very clever codes. I think my team would like to share with you that they have written over 90,000 lines of code, which is equivalent to the first version of WhatsApp, I believe, that went out. All right. The Seva team collects data at a lot of at a pretty high frequency every 2 weeks, but data are collected constantly from the Govis, from the Fitbits. There are custom surveys every time they show up, and there are labs done every few months, right? So there is qualitative, quantitative, actively, passively collected data in this project. Seva members are very proud to be a part of this project. I had to take this photograph multiple times because she wanted to make sure that the wearable, her Fitbit, was seen in the photograph along with the sensor, of course. And there is, a fair amount of laborious work done on the field to collect these data. Again, as you see from here, it is entirely run by these women. There are all kinds of apps that are native to this project that allow for the monitoring and evaluation, right? It is not easy to follow 800 people every 2 weeks. All of you have done field work, so you can sort of see the nudges you need, the behavioral nudges, the incentives, etc., right? And it's Seva, so it's all carrots, no sticks, right? So this is the scope of inquiry, right? These are the various things that are being captured in the study. There's physiology, movement, participant characteristic, blood work, environmental conditions. They even go and map out the houses when they onboard someone, so we know where the windows are, what the material of the roof is, what the bricks are, etc. Here are the key findings, folks. One is that the homes of the poor don't cool down. So what you're seeing in the graph on the top is that even when the nighttime temperature drops, first of all, it's hot, but it drops, the homes remain hot. Okay, and I won't belabor why they remain hot. There are other experts here who will give you a better explanation, but we all can imagine what the thermal lag is from the material that is used for informal housing in India. The second thing, and this is really scary, is that the heat index doesn't change much after summer, right? After summer, everyone breathes a sigh of relief, and says heat action plans can now sort of be scaled back. The monsoons have come, all our nursery rhymes celebrate the coming of the rains, right? Except that the humidity goes up, and actually people feel as miserable. And then you think about the ventilation in our homes and how even in middle-class homes, when it rains, you shut all the windows and it feels quite miserable until you can open your windows again, and then it has cooled down, right? So that's miserable, again, in the lived environments of the poor. We found a tight correlation with temperature and heart rate, which was very worrisome. We actually found that the women remained tachycardic for a very long time, for weeks at end. And when we dug deeper, we found that much of it was also correlated with the amount of anemia that you see in India. 50% of India's women are anemic, right? And so here is what is happening. It is hot. You are dehydrated, your physiological response is to increase your heart rate. to be tachycardic all the time. One of you was sharing with me your perceptual surveys in Pune, and the women are saying, घबराहट होती है. We've heard exactly the same phrase in Gujarati, घबरामण થાય છે, दिल धक धक करे છે, right? You're having palpitations. This is not all made up. This is not psychosomatic. Their heart rates are beating, their heart rate is elevated at unhealthy levels for a long time. That's a huge physiological demand on their heart. And the question that this raises is the intervention here a cool roof, or is it iron tablets to get their anemia down first? Daily wages go down by 50 to 60%. You're a daily wage earner, and for weeks to months, if you get only half of what you were already at, you have precarious existence, and you have no social safety nets, right? And this is what a lot of the gig workers have talked about. It's also different, right? For the street vendor, it's not only because the produce spoils, it's also because the grahak doesn't come in the afternoon. You've sort of lost, that demand. For the home-based artisan, she's just not able to produce as much as she can because she's tired, it's hot, it's humid. So there are different reasons for it. There was a tight correlation with age as well, and who sort of was disproportionately affected. You don't sleep enough, you don't sleep well, right? I'll pause there, and these are just the early findings. We're just at the start of the study. This was from the first 150 women. This expands to 8 trades by 2026. And probably over time, so I'm going to pause here, because I think the interesting discussion is not, what's next for the Seva and the Harvard team, but it's really inviting your responses and your reflections. This was just meant to be a provocation for all of you to start a conversation, so thank you for listening.
Thanks so much, Sachit. That was great. I'm going to dive right into the discussion, and I'm going to turn it over to some of the folks who have been on the ground and working on the ground for so long. So, Vidya, if I can start with you, right?
Sure.
So, a lot of these findings underscore issues that you've studied and worked on for years. Can you tell us a little bit about what you find in these studies that is interesting? Because a lot of this is stuff that you probably know and have seen intuitively, but it would be nice to hear from your perspective, given that this has been your world well before many of us started thinking about heat.
Sure. Thank you very much. It's a fantastic study, and when Sachit was talking about how hard it is to follow these workers, 800 of them for so many times, it's like amazing work. See, one of the things that I would like to tell here, the recent study that we have done with about 450 migrant workers, is we wanted to see who is most vulnerable. Outdoor workers, there is always this feeling that they are like most vulnerable, and then we wanted to see, we saw outdoor workers, we have about 2,000 of them we have worked with, and then we wanted to do a comparison between who is most vulnerable. Is it the outdoor workers or outdoor workers and migrant workers within the outdoor workers? So we found the migrant workers to be much more vulnerable, and it's just they have the same exposure, the same kind of work, but we found the vulnerability to be much, much higher among the migrant workers compared to the outdoor workers. Many factors. See, one thing is about the temperature and the humidity and the manual workload, but the second thing is about the kind of core risks that they have. Outdoor workers, if they are locals, they have their own homes, they have a little bit more social stability, they have a support system. But when it comes to migrant workers, even if they are internal migrants coming from Bihar or from Uttar Pradesh, one thing is the language, and they live in temporary makeshift homes. We have been speaking about building envelopes that actually make it more like a convection oven inside, and they do have small cooling facilities which makes the hot air circulate inside, and we found them having much more health, mental and cognitive issues. They have sleep issues, they have measured, we have also measured them, and then we find them starting the next day at a already low. So we cannot expect them either to perform well health-wise or productivity-wise. So we we have to kind of move away from just temperature. Thermometer is not going to measure all of this. We have to move away from the temperature based thresholds to physiological based threshold, heat vulnerability indexes that kind of cover, like, where they stay, all the other kind of cores that are, because it is just not the temperature that's doing the whole thing. I'll stop with this.
Yeah, thank you. And I think that distinction between migrant, the vulnerable that are migrant and the vulnerable that are non-migrant, but also the role of the built environment in mediating heat. We keep coming back to that. I'm going to ask Sahil to talk a little bit from Seva's vantage point in this study, because this is a large study, 800 women over 13 months, and it's going to make a big contribution to the science. But how is this useful for Seva?
Radhika, before I jump in, is it okay if Fozia Ben, our
please,
grassroots leader, talks about
yes.
it?
नीचे नु बटन दबाओ चलो
मेरा नाम फौजिया है। मैं एक सिलाई कामदार की लड़की हूँ और मैं खुद भी एक सिलाई कामदार बहन हूँ। मैं बहनों की बात करूँ तो हमारा अभी तक कोई अस्तित्व नहीं था, हमें किसी ने संगठित किया ही नहीं था, लेकिन सेवा के साथ जुड़कर हम एक संगठितता मिली और उसके साथ साथ हमने ये सेवा में सेंसर का प्रयोग शुरू किया। सर्वे तो बहुत होते थे, लेकिन सर्वे से हमें ये नहीं पता चलता था कि उसका परिणाम क्या आएगा। इस सर्वे में हम बहनों को जो परिणाम आता है वो बताते हैं और गर्मी से उनके शरीर पर, उनके मानसिक स्वास्थ्य पर और उनके आर्थिक स्वास्थ्य पर क्या असर होता है हम उनको वो भी बताते हैं। पहले तो बहनें मानने को तैयार नहीं थी कि गर्मी की वजह से उनको बहुत सारी प्रॉब्लम्स हो सकती है, लेकिन जब ये सर्वे शुरू हुआ और इसमें हमने एक फॉर्म भरना शुरू किया जिसमें हम उनका थर्मामीटर से टेम्परेचर मापते थे और बीपी भी मापते थे और गर्मी की वजह से उनके काम पर क्या असर होता है उसका भी फॉर्म भरते थे। और जब हम उसके बारे में उनको बताते थे तो उनको भी ये चीज़ का एहसास होने लगा कि हाँ, गर्मी की वजह से हमारे ऊपर बहुत चीज़ों का असर पड़ता है। उसके साथ साथ हम 3-3 महीने में उनका बॉडी प्रोफाइल कराते थे, जिससे हमें ये भी पता चला कि कितनी बहनों को डायबिटीज़ निकला, कितनी बहनों को एनीमिया की तकलीफ निकली, किडनी इन्फेक्शन निकला और बीपी हाई भी निकला। तो हमने उनको ऐसे छोड़ नहीं दिया, हमने उनको डॉक्टर के साथ संपर्क कराया और उनको वहाँ तक लेकर गए कि उनकी दवा चालू हो। हमारे पास ऐसा कोई डेटा था नहीं, तो अब जब हमने ये सर्वे शुरू किया तो हमारे पास एक डेटा आना शुरू हुआ है। तो शायद हम ये डेटा इकट्ठा कर इसको हम आगे ले जाकर बहनों के लिए कोई पॉलिसी बना सकते हैं और वो पॉलिसी सिर्फ सेवा की बहनों के लिए नहीं, सभी बहनों के काम आ सकती है।
To just add to what Fozia Ben just said, I think there are a couple of key points that she touched on. One is that there are so many surveys that are done with informal sector workers, with poor and vulnerable workers, but very little of that actually is conveyed back to them. So I think this is one of the first studies that is trying to get actionable insights from a study and in very real time communicate that back to the community to know what they are suffering from and what are the possible mechanisms to redress that. I think that's one key aspect where we're translating actionable insights into behavioral change. And I think that's a key link that needs to continue in all research studies. The second aspect of this study is that we are also looking at what are potential solutions and which ones of those could have the most benefit to poor and vulnerable communities, which can be the most cost effective and which can be actually scalable. So there are climate adaptation and mitigation solutions. Sachidbhai spoke about our climate insurance program. There's a whole gamut of solutions that are currently being piloted, but given the constraint in resources, given that finances are going to be limited, which ones of those actually should be scaled up? I think that's an important discussion, not only for the governments, but also for organizations like us, where we can better our internal programs. The third thing is from purely a data standpoint. There are so many data systems that are totally siloed. There's labor and health and weight and productivity, and all of these don't talk to each other. And even the data that comes is not gender disaggregated. So I think that's a key gap that we need to resolve going forward, where we are able to quantify the actual impact on women workers. I don't think right now, the way the data systems are structured, we are in a position to do that.
So we hear about the impact on the science and then in the community. And then Vidya, I was wondering if you can say a little bit about what impact this might have for policy.
I know if I'm not politically correct, I'm not really sure about. See, the way heat action plans are currently designed, it does not consider anything to indoors, or it's not gender sensitive as well. So the thing is, we need to rethink how heat action plans are going to be. There is mention of pregnant women, there are mention of vulnerable people, older people, younger, and also workers. But how are we going to try and protect them, help them, try any mitigation plans or preparedness for them is not well articulated in that. And again, like, is it even like here when he was talking about scalability as well? Is it even possible to scale it up for 148 billion people, right? And we have about 673 million workers in India, and especially the informal sectors, the gig workers, like millions. So how are we going to reach each one of them? This is a major question that we need to ask ourselves. And when we are talking about feasibility and sustainability of any of these, so some of the things that I think might kind of work is about we need to have something explicitly for indoor workers, small and medium enterprises. We have millions of small and medium enterprises where home-based workers, informal workers, gig workers, and we need to have something specially designed for them, explicitly saying what needs to be done for this. One of the things with gig workers, I think the next discussion is going to say that as well, is make these employers accountable. Kind of, we were speaking about the parametric insurance. We do have insurance systems in place, and we can have the employer and the employee just make a small contribution, so that way there is a pool for the larger good. That's one thing that can be done. The second thing is when it comes to including heat days in especially the informal workers, the workers who are working in MGNRA, the PM Kisan, there are systems already in place, but again, heat days need to be included so that their wages are not cut. Like I said, he was talking about productivity offs, and when days where people cannot actually work outside, and days where the government says, these are very hot days, please don't go outside, how are these people going to earn? So they would anyway come back working because they need the wages. So few things like this can be done. And one last thing is in small and in informal settlements, in slums, if there is an electricity subsidy that can be done for these people, because those are the ones who need the support the most. We are not talking about people who have multiple air conditioners at home, so maybe they can pick up some of the burden, and then subsidies can be given to the slums. Some basic things that can protect people who are living in such conditions. Thank you.
That's very helpful. And we're going to come back to talk about gig workers in the second half of this panel. I think this is a good time to bring Yogi in and hear a little bit from the ILO's perspective. How is the ILO approaching this issue in lower and middle income countries, particularly in countries where majority of the labor force is informal?
Thank you. Yeah. I think we have very good solutions that were mentioned today during the day. I have been here only since 1 o'clock. Of what I've heard, there are interesting solutions for a range of workers. But India is an interesting country with almost 90% of the workforce being informal. ILO sees heat-related diseases, stress, not as the climate issue, but a workplace safety and health issue, right? And one of the things that I got from the presentations, and it's lined with how the ILO is thinking about measuring of temperature. One has to look at the red globe bulb thermometer. One has to look at humidity, intensity of work, the nature of work that is done, and not just absolute temperature, which seems to be the case in India at this point in time. So those were the 2 points. In other countries, comparable ones. Now, you said low middle income countries, but I don't think India classifies as that. Certainly not the government. But comparable countries in BRICS context, Brazil and South Africa in particular, both of these countries have introduced legislation based on red globe bulb thermometer that triggers action. I'm very pleased to see the heat action plans. I was at the NDMA event probably in February. I said it there, I repeat it again. The heat action plans are good as long as on the last mile they also trigger workplace action. I have seen it to some extent in Ahmedabad, but I haven't really seen it in action. I was really pleased to see the platform workers air conditioning availability made in Tamil Nadu. So that's amazing. But I really think the issue with the gig workers, and perhaps we'll come back to that, I don't see them as informal workers. And that goes with how the Indian government sees it and rest of South Asia, because they're registered. But the informal economy is actually where you're not paying taxes or you're not registered. But I think there we really need to look at, again, a principle that I had floated at NDMA in February, the rewash principle: rest, water, shade, and yes, personal protective equipment, but that's the last line of defense. We have to look at source prevention. I'm very impressed with the studies that you have done, but I have to say this because history of occupational health suggests, occupational medicine, that from the time we get what health effects and exposure has to when it gets regulated and eradicated, it can take 40 to 50 years. Asbestos is a case in point. We don't need to do that with heat. I think we have enough science. I don't think we need more science. I think we need implementation, and as Sahil said, the ministries need to be sensitized. They need to sit together. Health, labor, environment, urban affairs, because they operate in silos. So I hope that that policy redressal happens as we move ahead. Thank you.
So Yogi, let me push you a little bit on this. So, you've laid out some of sort of the principles of what we need to be able to do, and you've also been working in India. So what is the hardest thing for you right now as you approach this issue in India?
Heat in particular, right? Yeah. And a disclaimer, I came back to India after 30 years in Scandinavia 6 months ago. So it's a more important disclaimer in Norway. But what I find is sensitization of higher bureaucracy on this, in particular, policy level understanding or acceptance. Be it gig workers, be it informal workers. I'm quite impressed that the NDMA and other agencies, I was at the ICMR, the Indian Council of Medical Research, last week. They want to float a program on safety and health for agricultural workers. They're also talking about heat stress. But labor workers is Ministry of Labor. And I think that more needs to be done at that level. And the new WASH codes are just instituted. I don't think, and correct me if I'm wrong, they do not include anything on heat stress or heat at all. So there is a possibility. The rules are under drafting. In fact, I'll be meeting the ministry next week, and I'm going to use some of this in my presentation, hopefully. Fingers crossed. Thanks.
Thank you. How about we take 5 minutes or so for comments or questions from the audience? Agreements, disagreements? Yeah.
Two quick questions for Sachit. So, one is in the East Coast, we found that apart from the physiological effects of heat, there was the physiological effect along the coast of drinking more saline water. With did you also find this in the form of higher blood pressure? That's my first question. My second question to you is, these sensors that you are talking about, have they been okayed by IMD and CPCB and people like that? Because the last time private people, organizations tried to use sensors to look at air pollution data, they were rubbished by CPCB and SPCBs.
So on the last question, they have been validated against sort of benchmark standards, and we documented that. And then there is also they also expire, right? Like these cheap sensors are not going to last for the entire length of the study, so there will be a second round just to make sure they're working. And that's the extent of the validation. So the lab control validation has been done after they've been purchased, before actually the sensors arrive in the field. The hypertension we have observed continuously, and I don't think I have a hypothesis for it, because it'll be multifactorial. So I'm putting on my clinical hat. So much of this, there's metabolic syndrome, even amongst the poor, right? They're pre-diabetic. It's the effect of heat, it's dehydration. This high BP business is showing up in study after study, and I think it warrants closer look. It may not just be related to salinity. I think there's something else going on which needs to be looked into, and probably very closely related with the diet of the poor in India as well. Yes. Hanji.
Don't have final results. But you mentioned something about anemia and women. And a huge number of women and even adolescent girls and even children are anemic in India. So are you saying that, and you're a doctor, a medical doctor as well, so that other things being equal, let's say a well-nourished person vis-a-vis an anemic person, child or adult, given the same heat stress, there will be differential
100%.
outcomes?
100%.
This is something I've never heard, it has not been publicly because anemia
it's not
is
as a public discourse.
Yeah.
It's not a surprise to a clinician or a physiologist, but one had never thought about it at this scale.
Yeah.
So yes, we had not expected to be conducting a heat study and finding this as a significant determinant of outcome. We happen to do the blood
What
test.
is it? Is the metabolism an anemic person responds to?
No, your hemoglobin carrying capacity is weak, right? So anemia is just decreased red cells. So the molecular level, you're already compromised. And then if you're dehydrated, so the anemic person is probably already a little tachycardic, and then you do dehydration on top of it, it just exacerbates the underlying inability to get enough oxygen at the cellular level. And so you'll do what you need to. You'll breathe faster. You'll beat your heart faster.
Thanks.
Correct. Yeah. I would, Fawzia, better you like to answer? Very slow is my response to it, and it takes over a year, but please.
फौजिया बहन, उनका सवाल ये है कि जब आप घर में जाते हो, काफ़ी सारे मेंबर्स आपको ये भी बोलते होंगे कि नहीं, हमको सेंसर्स नहीं लगाने। तो आपने अब फील्ड में क्या सुना था कि सब मानते हैं सेंसर्स लगाने के लिए, कि आपको उसमें दिक्कतें आती है?
जब शुरुआत में तो हम सेंसर लगाने गए तो बहनें राज़ी नहीं हुई, क्योंकि बहनों को ऐसा लगता था कि सेंसर के अंदर कैमरा है जो उनके घर का पूरा फ़ोटो ले लेगा, और ये जो घड़ी हम फिटबिट जो हम देते थे तो उनको ऐसा लगता था कि सैटेलाइट से कनेक्ट है। तो कुछ बहनों को शुरुआत में ऐसा लगा उनकी हार्ट बीट बढ़ गई है तो फिटबिट पहनने से बढ़ गई है, और कुछ लोगों को ऐसा लगा कि मतलब कैमरे की वजह से हमारे घर का डेटा बाहर चला जाएगा। तो शुरुआत में
there is no camera, right? But still, yeah.
तो कुछ बहनें तो ऐसी थी जिनके हस्बैंड ने हमारा सेंसर ले जाके बाकायदा दिखाए कि इसके अंदर कैमरा तो नहीं है, और 3-4 दिन फिटबिट भी जो थी ना तो उसको उतार के देखे कि ये सैटेलाइट से कनेक्ट तो नहीं है। कितनी बार हमने उनको समझाया, कितनी बहनों को तो ऐसा था कि लूज मोशन किसी किसी को शुरू हो जाता था तो वो हमें कॉल करती थी कि आप आओ, आपका सेंसर लेके जाओ, मुझे ये प्रॉब्लम हो रही है। लेकिन जब हमने उनको धीरे धीरे समझाना शुरू किया और हम बार बार उनके पास जाते थे, और सेवा से जुड़ी हुई थी बहनें तो सेवा पे विश्वास था उनको, तो 10% बहनें जब मानी तो समझ लो हमारा 50% काम हो गया, क्योंकि जब 10% बहनें मान गई थी तो उसके बाद उसके पीछे दूसरी बहनें भी धीरे धीरे मानना शुरू हो गई थी। तो घर खाता में तो हमको इतनी तकलीफ पड़ी थी कि बहनें हमें बार बार कॉल करती थी कि मुझे रात को नींद नहीं आ रही है आपकी घड़ी पहनने से, ये मोबाइल हम स्विच ऑफ करके सोएंगे क्योंकि हम सोएंगे तो हमारे घर का डेटा चला जाएगा। लेकिन हम उनको समझाते थे कि क्योंकि उनके अंदर जो आईडी भी हमारी जो आईडी बनी हुई थी, जैसे बहन का नाम था सुनीता तो आईडी करिश्मा नाम की बनी हुई थी, तो फिर हमें उनको पूरा समझाना पड़ा कि जब आपको कोई पहचानता ही नहीं है तो आपका डेटा कैसे बाहर जाएगा। और धीरे धीरे जब उनको विश्वास आने लगा और जब फिटबिट की अहमियत वो खुद समझने लगी, कितनी बहनों को हमने हार्ट रेट के बारे में समझाया, जिसमें से एक बहन थी तो उनका हार्ट रेट हमेशा बढ़ जाता था। हम जब बीपी मापने जाते थे तो उनके घर वालों को भी इन्वॉल्व करते थे कि ये बहन का बीपी बार बार ज़्यादा आ रहा है, अगर कोई प्रॉब्लम हो तो आप डॉक्टर के साथ कंसल्ट करना। तो एक बार ऐसा हुआ कि एक बहन चक्कर खा के गिर गई, लेकिन उसकी जो लड़की थी उसको हम बार बार बोलते थे कि ये बहन का बीपी ज़्यादा आता है, लेकिन वो बहन मानती नहीं थी डॉक्टर के पास जाने के लिए। उसकी लड़की को याद आया तो उसने तुरंत अपने फादर को फ़ोन करी और उनको सरकारी अस्पताल में लेके गए, और वाकई में उनका बीपी हाई हो गया था जिसकी वजह से वो चक्कर खा के गिर गई। डॉक्टर ने बोला अगर आप इनको समय पे नहीं लाते तो इनको आधा पैरालाइज मार जाता। तो जैसे ही वो बहन अच्छी हुई तो हॉस्पिटल से ही फ़ोन किया हमारे जैसी आगेवान बहन को और कहा थैंक यू, अगर आप मेरे घर में बता के नहीं जाते मेरी लड़की को ये, तो आज मैं बिस्तर पे पड़ी होती और ये लोग मेरी सेवा करते। तो जब धीरे धीरे बहनों को रियलाइज होने लगा कि ये सेंसर अभ्यास अच्छा है तो हमारा काम आसान हो गया।
Thank you, Fazia, man. Seva should also consider getting some royalties for Fitbit for this free advertising. Yeah. So, it's just very involved in the sense that you can't just roll this, it's Fitbits and sensor. What we also do is actually meet with the team twice a week. And there is results are pushed out in small doses to all the members in Gujarati. The goal is to actually ramp it up into little instructional videos and stuff. So no one feels like a data subject. Yeah. Oh, yeah. Go for it. Yeah.
So there is a consent form. All the members are informed about it. They are informed about the study itself and what is the purpose of the study. And we also have regular meetings with them just to socialize the results that are coming from the study. So it's completely voluntary. We have had members who have left the study midway as well. But most of the members, I would say 99% of the members, have been retained in the study.
It goes through Harvard IRB, local IRB, community IRB, and whatnot. So it's
all right. Pretty standardized formats of how to conduct a study and how to seek consent. You cannot just go into a community and start asking questions.
Let's keep moving. We'll open it up for discussions. Thank you, Professor Khosla, for moderating that last set of questions. If y'all are okay with it, I think we invite Apekshita for the lightning round, because it's just one lightning talk. So a quick talk and then a discussion with Sheikh Saab and Dr. Adab.
Hello, Namaskar. The presentation is in English, so I would like to speak in Hindi so that there's maximum reach. For those not comfortable in Hindi, I'd request you to follow the presentation and happy to also share the report later. तो सबसे पहले हमने 2024 में एक स्टडी की जो हमने तेलंगाना गिग एंड प्लेटफॉर्म वर्कर्स यूनियन के साथ की. शेख सलाउद्दीन यहाँ बैठे हैं और हमने 166 गिग एंड प्लेटफॉर्म वर्कर्स का सर्वे किया ये समझने के लिए कि उनको गर्मी के वजह से क्या परेशानियाँ हो रही हैं. और ये सर्वे करने से पहले हमने उनके एक सेशन किया जहाँ पर एक डॉक्टर ने आके हीट स्ट्रेस अडेप्टेशन मतलब गर्मी क्या होती है, गर्मी के वजह से क्या परेशानियाँ होती हैं, किस तरीके का सेहत पे असर पड़ता है, उस बारे में बहुत सारी जानकारी दी. और हमने उस सेशन में बहुत सारी ऐसी बातें सुनी जो जिसको सुन के हम चौंक गए. जिस तरीके से पहली बात तो ये कि बहुत सारे गिग एंड प्लेटफॉर्म वर्कर्स में ये पूरी बहुत ज़्यादा अवेयरनेस आ चुकी है कि गर्मी के वजह से उन पर क्या असर हो रहा है. तो बेहोशी, सरदर्द, डिजीनेस, महिलाओं में मासिक मेंस्ट्रुअल इश्यूज़, ये सारी चीज़ों की जानकारी लोगों में बढ़ती जा रही है. और हमें क्लास और कास्ट के बारे में भी बहुत ही अनोखी चीज़ें पता चली. जैसे हमने एक ड्राइवर से पूछा कि आप सनग्लासेस पहन के क्यों नहीं चलाते हैं क्योंकि आँखों पर बहुत असर पड़ता है गर्मी का. तो उन्होंने कहा कि अगर मैं सनग्लासेस पहन के चलाऊँगा तो जो पैसेंजर है वो सोचेंगे कि पता नहीं मैं कहाँ का बहुत बड़ा बिग शॉट हूँ जो मैं उनको लेकर जा रहा हूँ. तो ये सारी चीज़ें भी हैं जो हमने समझी कि किस तरीके से असर पड़ रहा है लोगों के ऊपर. सबसे पहली चीज़ ये कि 52% लोगों ने कहा कि उनको हीट एग्जॉस्शन होता है. हीट एग्जॉस्शन को लोग गर्मी से बहुत ज़्यादा थकावट का नाम देते हैं फील्ड पे. दूसरा 30% लोगों ने बोला कि उन्हें हीट स्ट्रोक हो चुका है. हीट स्ट्रोक को लोग गर्मी से दौरा, गर्मी से बेहोश हो जाना, इस तरीके से लोग बताते हैं उसे. और ये सारी चीज़ें ऑलरेडी लोगों ने बताई कि वो हो रही हैं उनके साथ हैदराबाद में हर समर में. दूसरी चीज़ हमने ये वाली जो स्टडी थी उसमें हम बहुत कम महिलाओं से बात कर पाए. हमने 19 महिलाओं से बात की. उसमें से 13 महिलाओं ने हमें बताया कि गर्मी के वजह से उनके मेंस्ट्रुअल क्रैम्प्स और ज़्यादा बुरे हो चुके हैं और उनको यूटीआई वाली परेशानी भी बहुत ज़्यादा सामने आ रही है. और इसका साफ रीज़न ये है कि पानी पीने को नहीं है और साफ़ शौचालय भी अवेलेबल नहीं है शहरों में जहाँ पर महिलाएं काम कर रही हैं. और ये बेसिक फैसिलिटीज़ जो ऐसी चीज़ें हैं जो बहुत ज़्यादा ज़रूरी हैं गर्मी से जूझने के लिए, वो सारी चीज़ें बिल्कुल नहीं है हमारे शहरों में अवेलेबल. 65% जिन लोगों ने हमने जिनसे बात की उन्होंने कहा कि उनके पास साफ़ पीने का पानी की बहुत ज़्यादा ज़रूरत है. और 55% ने कहा कि शेडेड रेस्ट एरियाज़ की बहुत ज़रूरत है क्योंकि वो लोग एक डिलीवरी से दूसरा डिलीवरी जब करने जाते हैं तो अक्सर वो लोग फ्लाईओवर के नीचे या ऐसी अन्य जगहों पर जिनको आप रेस्ट एरिया बिल्कुल नहीं बोल सकते वहाँ पर बैठ के वो लोग आराम करने की कोशिश करते हैं. कुछ रिकमेंडेशंस भी सामने आए. सबसे पहले तो ये कि हीट वेव को नेशनली डिज़ास्टर का करार दिया जाए ताकि उसकी फंडिंग अवेलेबल हो पाए राज्यों के पास. और कूलिंग और आराम करने का इंफ्रास्ट्रक्चर मौजूद हो लोगों के लिए, जिस तरीके से चेन्नई में कूलिंग स्टेशंस बनाए गए हैं. और पीक आवर, ये एक जो एल्गोरिदम है जिस तरीके से लंच आवर के वक्त बहुत ज़्यादा डिमांड होती है लोगों को काम करने की, तो लोग बिल्कुल पीछे नहीं हट सकते. उनको वो काम पूरा करना ही है अगर उन्हें पैसे कमाने हैं. तो उस वक्त का जो कॉम्पेंसेशन है वो बहुत ज़रूरी है अगर हम चाहते हैं कि लोग 12 से 4 या 11 से 3 के बीच काम ना करें. हेल्थ केयर और ट्रेनिंग पर भी लोगों ने सवाल उठाए कि किस तरीके का हेल्थ केयर मौजूद है. ज़्यादातर लोगों को प्राइवेट हेल्थ केयर जाना पड़ता है और किडनी स्टोन्स वगैरह के इश्यूज़ बहुत कॉमन हो चुके हैं और वो प्राइवेट हेल्थ केयर में जाकर ही वो लोग अपना इलाज करा पाते हैं क्योंकि जो बहुत सारे पीएचसी हैं वो टाइमिंग बिल्कुल भी सूट नहीं करती है गिग एंड प्लेटफॉर्म वर्कर्स को. इसके बाद क्योंकि हम सिर्फ 19 महिलाओं तक पहुंच पाए थे स्टडी में, हम फ़िलहाल दिल्ली एनसीआर में सिर्फ महिलाओं से समझ रहे हैं कि उनको किस तरीके की परेशानियां हो रही हैं गर्मी को लेके। हमने दिसंबर जनवरी में एक बेसलाइन स्टडी की थी, फोकस ग्रुप डिस्कशन किए थे गिग एंड प्लेटफॉर्म वर्कर्स जो महिलाएं हैं उनके साथ, और आप देख सकते हैं कि 26 महिलाओं में से 15 महिलाएं कहती हैं कि वो 9 घंटे से ज़्यादा प्लेटफॉर्म पे काम करती हैं। तो ये जो एक फाइंडिंग है ये बिल्कुल साबित करती है कि गिग वर्क, जिस तरीके से हमने शुरुआत में बोला था कि गिग वर्क फ्लेक्सिबल काम है, आप जब चाहे कर सकते हैं, आप जब चाहे पीछे हट सकते हैं, गिग वर्क वैसा बिल्कुल नहीं रहा है। लोगों को 9-10 घंटे काम करना पड़ता है, और उसके बाद जाके भी वो लिविंग वेज, मिनिमम वेज नहीं, लिविंग वेज वो लोग अप्रोच नहीं कर पा रहे हैं। 26 में से 5 महिलाओं ने कहा कि वो बिल्कुल भी ब्रेक नहीं लेती हैं अपने काम के वक्त, और 7 महिलाओं ने कहा कि वो एक ब्रेक लेंगी जो खाना खाने के वक्त। और ये हमने, वापस मैं याद दिला रही हूँ कि हमने दिसंबर जनवरी में ये बात की, और हमने उनसे पूछा कि वो आने वाली गर्मी के वजह से वो कितनी चिंतित हैं, और 1 से 5 में से 5 महिलाओं ने कहा कि उनको इतनी ज़्यादा चिंता है कि आने वाली गर्मी में उनकी आमदनी पर क्या असर पड़ेगा और उनके सेहत पे क्या असर पड़ेगा। ये कोट बहुत ही ज़्यादा ज़रूरी है जो सोनम नाम की एक ब्यूटी वर्कर है, उन्होंने कहा कि वो पहले अपना काम चुन सकते थे कि वो कितना काम करना चाहते हैं, कब काम करना चाहते हैं, और अब जो पीक आवर पॉलिसी आ चुकी है उसके बाद वो बिल्कुल भी ये ब्रेक नहीं ले सकते। जो हम फ़िलहाल सर्वे कर रहे हैं उसकी मैं प्रिलिमिनरी इंसाइट्स भी शेयर करना चाहूँगी कि 17 हमने लोगों से अभी तक बात की है, 17 महिलाओं से, और सारी 17 महिलाएं कहती हैं कि उनको बीमारी के बावजूद काम करना पड़ता है, बिल्कुल भी वो काम करने से रुक नहीं सकती। 17 में से 11 महिलाओं ने कहा है कि वो रोज़ाना उनको हीट रिलेटेड सिम्टम्स होते हैं, जैसे चक्कर आना, सर दर्द होना, UTI वाली तकलीफ़, ऐसी अन्य तकलीफ़ें उनको रोज़ाना हो रही हैं। 15 महिलाओं ने कहा 17 में से कि उनकी आमदनी कम हो जाती है गर्मी में, और उसके साथ साथ 4 महिलाओं ने एग्जैक्टली हमें अमाउंट भी बताई कि उनको 2000 तक उनकी जो आमदनी है वो कम हो रही है, और ये ऐसे वक्त में जब 10 से 20 हज़ार उनकी महीने की आमदनी है। और 17 में से 13 महिलाओं ने कहा कि उन्हें पैसा बोरो करना पड़ रहा है अपनी बढ़ती हुई समर कॉस्ट को पूरा करने के लिए, जिसका मतलब ये है कि गर्मी की वजह से और ज़्यादा डेट ट्रैप्स एक तरीके से खड़े हो रहे हैं, क्योंकि हमने बहुत सारे लोगों से सुना है कि वो सारा अपना पैसा इकट्ठा कर रहे हैं ताकि वो घर में एक कूलर या एक AC ला सकें। और ये कोट के साथ मैं एंड करना चाहूँगी। जो आरती हैं, एक गिग वर्कर हैं, उन्होंने कहा कि हमें अपने हक चाहिए, हमें PF चाहिए, हम अपनी हमारी एनर्जी, हम अपनी जवानी लगा रहे हैं इस काम में, और हम चाहते हैं कि कम से कम हमारा बुढ़ापा तो सिक्योर रहे, क्योंकि फ़िलहाल ये बिल्कुल भी हमें आसार नहीं दिख रहे कि हमें कोई भी किसी भी तरीके के प्रोटेक्शंस मिल रहे हैं इस काम से।
Much for this very important work. We had invited Zomato to partake in this discussion, and I have to put on record that they withdrew from participation, precluding an opportunity to engage with the scientists, policymakers, and the gig workers themselves that are present here. May I invite Sheikh Salahuddin to respond to the findings from Apekshita.
थैंक यू सो मच। जैसा सबसे पहली बात तो गिग और प्लेटफॉर्म वर्कर्स को देखा गया तो हीट वेव के अंदर अब जो 5 कानून निकले, स्टेट गवर्नमेंट्स और सेंट्रल गवर्नमेंट भी ड्राफ्ट रखा, इसमें कहीं पे भी जो है गिग और प्लेटफॉर्म वर्कर्स को आइडेंटिफाई हीट वेव के ऊपर या डिजास्टर के ऊपर कहीं पे भी मेंशन नहीं किया गया। ये सबसे बड़ी कमी है। हम लगातार स्टेट और सेंट्रल गवर्नमेंट्स को तो रिप्रेजेंट करते जा रहे, बट देखना है कि इसको किस तरीके से रूल्स के अंदर तो एटलीस्ट इन्वॉल्व कर सकते। दूसरी बात, जो भी प्लेटफॉर्म कंपनीज़ के ड्रेस कोडिंग्स अगर जब हम देखेंगे, जो ये बीच में बहुत बड़ी चर्चा आ रही, वो डार्क कलर्स है। ब्राइट डार्क एकदम, आप ये नहीं बोल सकते कि उससे बच नहीं सकते, जैसा कि ब्रिंजॉल कलर जेप्टो का है, स्विगी का जो है ऑरेंज है, डार्क ऑरेंज है, और जोमेटो का डार्क रेड है। तो मल्टीपल टाइम्स हम डिफरेंट स्टेक होल्डर्स मीटिंग्स पे भी बोले कि उनका कलर थोड़ा लाइट दिया जाए। एक तो ब्रांडिंग के लिए उनके खुद के वर्कर को जो है वो जब जैसा जिस्म पे पहनते, जो उनका जर्किन भी है, जो टी शर्ट्स है, वो टी शर्ट्स भी जो है धूप से जलते रहते बॉडी पे, और मस्ट एंड शुड है वो एवरी 1 आवर को अपना सेल्फी देना है, और वो बैग के साथ और वो टी शर्ट के साथ। तो पता नहीं है प्लेटफॉर्म कंपनीज़ का वो बिहेवियर थोड़ा चेंज हो गया, तो उससे वर्कर्स को कहीं ना कहीं बेनिफिट हो सकता। एक तो प्लेटफॉर्म कंपनीज़ जैसा खुसूसन जोमेटो लास्ट टाइम बोला कि हम लोग रेस्ट रूम्स बनाए हैं, मगर आज के तारीख में देखेंगे आप भी बहुत सारी जगह वो रेस्ट रूम कहाँ पे है नहीं दिख रहे। मेरे हैदराबाद में ख़ुद जोमेटो को रेस्ट रूम के इनाग्रेशन के लिए बुलाए थे, गया, बट रिबिन मैंने कट कर, अच्छा हुआ, बट वो 3 महीने के अंदर वो रेस्ट रूम फिर दिखा भी नहीं आज तक। ऐसे कई सारे जो है सिर्फ पीआर के हद तक प्लेटफॉर्म कंपनीज कर रहे, दिखावे के लिए नहीं, कहीं ग्राउंड पे रियलिटी होना चाहिए, वो वर्कर के लिए बेनिफिट पहुंचता। और खुसूसन जोमेटो जैसे, स्विगी जैसे अभी प्लेटफॉर्म कंपनी जैसा हम लोग ने लास्ट ईयर और ये ईयर भी ग्लास ऑफ वाटर की कैंपेनिंग स्टार्ट करी TGPW से। तो उस टाइम पे आप देखे होंगे इन लोगों ने एक छोटा सा ORS का बॉटल बांटा, उसके लिए भी सेल्फी भेजी, वो भी PR ज़बरदस्त करे, पेपर में आया, टीवियों में भी आया, सोशल मीडिया में भी आया। कि मैं बोल रहा हूँ कि यस, वो ORS हर दिन बांटिए प्लेटफॉर्म पे, हर दिन वो वर्कर्स को दीजिए, कि वो एटलीस्ट जब आपका डिमांड और पीक टाइम है वो ऐसे टाइम पे है, लंच टाइम पे, बहुत उस टाइम पे धूप रहती, आप तो देख रहे होंगे 43 के ऊपर धूप चले जा रही, मगर उस टाइम पे भी जो है प्लेटफॉर्म कंपनीज जो है उनके खुद के प्लेटफॉर्म्स के इंस्टामार्ट्स पे, वेयर हाउसेस पे भी उनके लिए वेटिंग एरिया नहीं है, रेस्ट रूम सीधे नहीं है, और वहाँ पे वो अपने गाड़ी के ऊपर आप देखे होंगे बहुत सारे जने ऐसा पीछे सीट करके ऐसा आराम करते रहते। इतने प्रॉब्लम होते पर कहीं कहीं तो सीढ़ियों पे बैठ जाते स्टेप्स के ऊपर। तो मल्टीपल टाइम्स हम लोग रिप्रेजेंट करें कि एटलीस्ट ये चीज़ को थोड़ा बदलाओ, एटलीस्ट कुछ छाँव के लिए कुछ टेंट वगैरह डाला करो। बट प्लेटफॉर्म कंपनीज अभी तक वो चीज़ लास्ट 5 ईयर्स से हम पीछे पड़ रहे हैं, मगर कोई चेंजेस देखने के लिए मिला नहीं। अगर जब हैदराबाद जैसा इंटरनेशनल एयरपोर्ट की भी बात करेंगे हम, RGI इंटरनेशनल नाम के लिए बहुत बड़ा है, हम सबको पता है, बट हम लोग वैसे एयरपोर्ट के अंदर भी 5 साल रेस्ट रूम के लिए लड़के, लास्ट ईयर हम लोग ने सक्सेसफुली रेस्ट रूम हासिल किया, और वो रेस्ट रूम में हार्डली 50-60 जने तो आराम से बैठ सकते, लेट सकते, बट हमें उसको और एक्सपेंड करने की ज़रूरत है, और वहाँ पे नीड जैसे कि बड़े कूलर्स लगाने की ज़रूरत है, कूल वाटर की ज़रूरत है, तो और थोड़े नीड ऑफ ज़रूरत है, वो GMR की ज़रूरत, GMR का फ़र्ज़ बनता है कि उस चीज़ को बनाए, क्योंकि वहाँ पे उनको रेवेन्यू जनरेट हो रहा, वो कैब ड्राइवर्स दे रहे, तो उस चीज़ को भी हम लगातार जो है गवर्नमेंट, स्टेट गवर्नमेंट को, GMR को और सेंट्रल गवर्नमेंट को भी हम रिप्रेजेंटेशंस करते जा रहे हैं। अभी जैसा बहुत सारे कंपनीज़ जो है प्लेटफॉर्म कंपनीज़ हीट वे के ऊपर आते जो है कहीं पे भी बात नहीं करें, अभी तक बात करना चाहिए। मल्टीपल टाइम्स कितने भी स्टेक होल्डर मीटिंग्स है, वो स्टेक होल्डर मीटिंग्स में उनका पार्टिसिपेशन नहीं रहता। आई डोंट नो वाई, बिकॉज बहुत सारे जगह हम लोग कोशिश करते कि एटलीस्ट ऐसे जैसे डेकोरम पे हम बैठे आपस में बातचीत करें और कुछ सोल्यूशन निकाल पाए, बट अभी तक उस चीज़ पता नहीं है क्यों नहीं हो रही। इवन दो ILO जैसे जगह भी रिकमेंडेशंस जब देते, ILO भी मल्टीपल टाइम्स बोला कि कलेक्टिव बार्गेनिंग होना चाहिए, बैठ के डिस्कशंस होना चाहिए, बट प्लेटफॉर्म कंपनीज अभी भी नहीं आ रहे। इवन दो 5 स्टेट्स में जब कानून बना तो वहाँ पे भी जो है अभी तक वर्कर्स का डेटा देने में प्लेटफॉर्म कंपनीज पीछे हैं। वहाँ पे सोशल सिक्योरिटी का वेलफेयर कुछ देना चाह रहे, वहाँ पे बोर्ड्स बनाना चाह रहे, मगर प्लेटफॉर्म कंपनीज अभी भी डेटा स्टेट गवर्नमेंट्स को, सेंट्रल गवर्नमेंट्स को नहीं दे रही। और चेन्नई एक अच्छा मॉडल है। हम इससे पहले सेशन में हम ऊपर सुने कि वहाँ पे गिग और प्लेटफॉर्म वर्कर्स के लिए रेस्ट रूम खोला गया। वो इंडिया का एक पहला ऐसा प्रोजेक्ट हम देखा जा सकते कि सारे गवर्नमेंट, स्टेट गवर्नमेंट्स भी आगे आके इस चीज़ को इम्प्लीमेंटेशन करें। उसके अंदर रिसेंटली शायद लास्ट मंथ दिल्ली गवर्नमेंट भी मैडम सीएम जी भी अनाउंस करे कि हाँ हम कुछ करेंगे मिलके ज़रूर, एक रिप्रेजेंटेशन हमारा गया तो डेलीगेशन पे एक्सेप्ट करके बोले, बट कितना टाइम लगता वो नहीं बोले, बट हाँ करेंगे बोल के तो बोले, बट आई डोंट नो अभी कितना टाइम लगेगा सरकारों को इस चीज़ के ऊपर सोचने पे। और रही बात एल्गोरिथम कंट्रोल, आप सबको पता है डिमांड एंड सप्लाई को जैसा कंट्रोल करता, जैसा कि पीक एरिया है, पीक टाइम है, सर्च है, जैसा बारिश हो रही तो वहाँ पे जो है डिलीवरी बॉय को मजबूरन भेजा जाता, वहाँ पे थ्रेटिंग कॉल रहता, वहाँ पे बारिश ज़्यादा हो रही, वहाँ पे नहीं जाना है, वहाँ पे एरिया ब्लॉक किया जाता, अनाउंसमेंट होता स्टेट गवर्नमेंट से, फिर भी उस टाइम पे नहीं सुना जाता प्लेटफॉर्म कंपनीज। एट द सेम टाइम हीट के ऊपर भी बहुत सारे स्टेट गवर्नमेंट्स अपने अपने अनाउंसमेंट किए कि सो एंड सो टाइम से सो एंड सो टाइम तक आप घर से बाहर नहीं निकलना, मगर आज भी प्लेटफॉर्म कंपनीज जो है मजबूरन उन लोगों को जो है डिमांड एंड सप्लाई बता के निकाल रहे, अब बाहर उन लोग को काम पे आने पे मजबूर कर रहे, मगर क्या उनको वो पैसा मिलता, क्या कोई ट्रांसपेरेंसी नहीं है कहीं पे भी फेयर पे। तो तेलंगाना गिग एंड प्लेटफॉर्म वर्कर्स यूनियन लगातार जो है लास्ट ईयर से और ये ईयर भी जो है वर्कर्स के और कंज्यूमर्स के बीच में एक जो गैप है वो दूर करना चाह रहा है। ग्लास ऑफ वाटर का जो कैंपेनिंग है, चाहे ड्राइवर हो, डिलीवरी बॉय हो, अर्बन कंपनी के वर्कर्स हो, एक गिलास पानी ऑफ़र करिए प्लीज़ बोल के हमें कैंपेनिंग दी, उसमें बहुत सारा अच्छा माइलेज आ रहा, कंज्यूमर्स बहुत एक्सेप्ट कर रहे हैं। और ग्लास ऑफ वाटर पैंडेमिक के बाद में फिर से हम लोग ये चीज़ को थोड़ा लाने के अंदर टाइम लगा, बट हाँ एक सिस्टम को थोड़ा बदलाने के लिए और सुधारने के लिए तो टाइम लगता ही लगता, बट अब कंज्यूमर भी बहुत हमारे साथ मिलके कोलैबोरेट हो रहे। हम लोग ने नो एसी कैंपेनिंग इसलिए किया था कि हमारे फेस सही नहीं थे, मगर आज के तारीख में प्लेटफॉर्म कंपनीज उसको ही सहारा लेके नो एसी का ऑप्शन कंज्यूमर को बता रहे हैं कि पैसा कम मिलता आपको नो एसी में। क्या आज के तारीख में चाहे ड्राइवर हो, कंज्यूमर हो, नो एसी में जा सकते इतने हीट में, और गाड़ी का हीट का टेम्परेचर एक बार एब्जॉर्व करे बाद में एटलीस्ट 40 मिनट्स लगता है आपको गाड़ी फिर से ठंडी होने में। तो इसको समझना चाहिए प्लेटफॉर्म कंपनीज। जो हम लोग कैंपेनिंग करें वो कैंपेनिंग का मकसद था कि जो प्लेटफॉर्म फेयर जो थे वो सही नहीं थे, वो फेयर के लिए हम लोग उनको बोले कि आप एक्स्ट्रा टिप ऐड कर सकते। अब प्लेटफॉर्म कंपनीज जो है उसको दूसरे तरीके से रुख अंजाम दिए। लास्ट टाइम जो है ये 2 कैंपेनिंग बहुत अच्छे हमारे सक्सेस हुए। इग्निशन ऑफ की जो कैंपेनिंग थी, हमने पोल्यूशन बचाने के लिए काम किया था और उसका अच्छा रिज़ल्ट आया। हर सिग्नल पे जो है तेलंगाना जैसे स्टेट्स के अंदर डिजिटलाइजेशन टाइमर लगाया गया, वहाँ पे आपको टाइमर के हिसाब से अपनी गाड़ी ऑफ़ कर सकते हैं और ऑन कर सकते हैं। ये एक बहुत अच्छा रिज़ल्ट तेलंगाना से निकल के आया, दूसरे स्टेट्स में भी अभी इम्प्लीमेंट होना स्टार्ट हो रहा। और आखिरी में बस मैं ये बात बताना चाह रहा हूँ, NDMA के जो एडवाइजरी निकला था लास्ट टाइम, बट वो स्टेट गवर्नमेंट्स अगर जा स्ट्रांगली इम्प्लीमेंट करे तो बहुत सारे जो है वर्कर्स का, अनऑर्गेनाइज वर्कर्स का, सभी का फ़ायदा होता। नॉट ओनली गिग वर्कर्स की बात कर रहा हूँ मैं कि सारे लोगों का फ़ायदा होता, बट कहीं ना कहीं अभी ये लूप और गैप है। गवर्नमेंट एक सिर्फ एडवाइजरी दे के छोड़ना नहीं, उसके एक रूल, एक मस्ट एंड शुड बनाने की ज़रूरत है। स्टेट गवर्नमेंट को पर्टिकुलर टाइम बाउंडिंग दे के इम्प्लीमेंटेशन के लिए बोले तो ज़रूर इस चीज़ के ऊपर कहीं ना कहीं इम्पैक्ट आके और वर्कर्स के वेलफेयर के ऊपर और आवाम को भी, जो नॉट ओनली सिर्फ ये वर्कर बोल तो गिग वर्कर ही नहीं है, अनऑर्गेनाइज वर्कर्स भी के लिए भी ये फ़ायदेमंद हो सकता। तो इस बात को मैं यहाँ पे ख़त्म करता हूँ। थैंक यू,
शुक्रिया। Adele, the discussion so far has largely been focused on the individual, right, and the exposure and sort of attribution of accountability, and sometimes there's a toolkit that the worker is forced to use and implement because either the state or the private sector hasn't stepped in, or there are recommendations, policy recommendations of state or technical representations. But you've thought about this very differently. Your book, Architectural Epidemiology, suggests that there is an adjacent path that is just not being considered at all. So can I invite you to share sort of what that book was about and what the body of your work is about, and how we are probably missing the boat on how else we should be thinking about this. I want to put this in the context of the fact that government, various ministries of the government of India often remind us that much of the built environment of India of 2050 has not yet been built. So what you're thinking about is very relevant here.
Thank you. And I apologize for my linguistic limitations, but I'm really honored to be here, and I just want to start by recognizing that I have researched kind of countries at all income levels, but the majority of my actual practice has been in the United States. So what I'm talking about, I hope will have some relevance, but I think that, you know, I would look to this group to kind of help me think through how my remarks would be most useful in the Indian context. I think that one of the things that has really kind of struck me through the conversation up until now today, I was asked to come and talk about built environment interventions that can be protective related to heat. And I have noticed many of them have already been talked about. We've seen presentations about how many of them have already been implemented, maybe in pilots, maybe more systematically. I've actually been paying attention in the small amount of time that I've been here to the built environment in New Delhi, and am seeing some of these adaptive practices that are already in place, and then also experiencing in my own body how hot and polluted. I haven't experienced humidity here yet, but I'm from Houston, Texas, which is subtropical, so I'm used to that as part of the equation. So I think, you know, so the idea behind architectural epidemiology is that at least in the United States, the way that architects and real estate developers approach a project tends to be very much focused on the parcel of land that is owned and controlled by whoever it is that's going to make a capital investment. And the rules that we have to follow in order to receive approval to construct that building are also very much focused inside that the property line. And the financing is looking to generate revenue inside the property line. And so what we end up with is kind of a disconnect between the decisions that are being made by the real estate developer, the architect, and the future occupant. They're focusing very much on their own little world, as though that parcel was, you know, a spaceship that was going to land on the moon, and not thinking about how it's connected to the surrounding, even just, you know, the sidewalk on the other side of the property line, much less the urban heat island or a floodplain, or how people access that site and what is the implication of that on air pollution, traffic deaths, etc. And so what architectural epidemiology does is it applies a neighborhood scale, holistic and kind of systematic understanding of the context where that project will be located, and then looks at the public health evidence that we have available to us today and says, okay, well, if this is going to be, I know we've talked about schools as an example, if this is going to be an elementary school, okay, well, we know that children are at higher risk of when they're exposed to heat. We know that this is a school that's located in an urban heat island in an area of town that has a lot of air pollution, and there's a lot of traffic, and so it's dangerous for children to walk to school. And so we take into account all of those different criteria, and we incorporate it into the design. And then we use metrics to help us decide the extent to which that implementation, that design was successful at achieving, at least some reduction in risk related to those elements that we looked at. And so it really combines some of these questions we've talked about around heat exposure, other climate change related exposures, mental health, and chronic disease into a framework that is systematic in the way that it's implemented, but is contextual in the outputs. And the thing that I think has really struck me about the conversation today, particularly Yogi's comment that 90% of the employment in India is in an informal sector, and then this conversation about gig workers and moving through the city to be able to perform your work, is that occupational health and the way that we consider the context within which occupational health should be implemented, whether it's policy or retrofitting or designing new buildings or new transportation systems, is to think about the entire built environment as occupational, as a component of occupational health. And I guess in just specifically thinking about heat, the way that the literature would encourage us to think about designing to reduce exposure to heat is kind of at two scales. One of them would be doing things to counter the urban heat island effect, both kind of at the regional scale and at the micro scale. And I think we've heard some of the ways that you can do that through, reducing traffic congestion, through, if you're going to continue to have so much concrete, make use of the concrete as a heat sink and a cooling opportunity as opposed to the engine of the urban heat island. Having more access to parks and like actual access to water so you can cool your body down. And then the other way is kind of at the smaller scale, protecting individual populations. And again, we've heard some of those design strategies, particularly related to the home, that we kind of divide into passive strategies and active strategies. Passive being things like white roofs, vegetated roofs, insulation, having outdoor canopies or brise soleil to protect the inside of the building, and making sure that there's airflow going through the building. Fans, I forget who mentioned, the other Dr. Adele. No, you mentioned fans. Yeah. But actually, I was thinking about the other Dr. Adele who spoke in the plenary about how, in a sense, we already have a lot of these strategies. I don't want to say that we have all of them. I think that there's been a bias in the literature to look at kind of Western engineering solutions to some of these problems, and that there's an opportunity for us to do more empirical research on maybe less engineered and more nature-based solutions, and learning from indigenous practices and just natural solutions that we could incorporate into the literature. But to me, the important thing is to recognize that this is not a one-size-fits-all approach. The way that you would make the environment that we're in right now, this building, like literally this room, could be much more conducive to a healthy experience in this session. But also, the immediate surroundings of this convention center, what you would do, even if you're just focused on heat and you're not considering humidity and air pollution, all the rest of it, those design strategies are going to be different than even potentially a kilometer away from here, right? And so recognizing that we take the same kind of analytical approach and talking with community to understand what their experience is, so that we can make sure that the responses are improving their lives, but that the actual design strategies cannot be one size fits all. They really have to be adapted to the context.
Thank you very much. I found your comment about treating the entire sort of streetscape as essentially the occupational workplace for so many workers in India very relevant. It reminds me of the moment when Seva very cleverly started calling the markets that we've grown up saying they are squatters and, they're sitting here and why are they clear the markets from the streets? And they started calling them natural markets, right? Because they're a natural response to the demand in these communities. People don't want to walk too far to go get their vegetables. And suddenly you sort of reframe this as the right to sort of vend, right? And that movement then ends in street vendors being legally recognized in India as well as globally. And so this idea that this is the workplace, and so occupational regulations, ought to apply in a different legal paradigm is very interesting. I think the natural follow-up to what you said would be for me to invite Ruchika Lal from IIHS to share sort of how we in India have been thinking about these issues.
Thank you. A lot of the conversation...
Ruchika, may I just interrupt for a second? I'm sorry. So as we invite the discussants, a lot of the prompts that have been shared with the discussants initially were also about sort of problem statements. I think we're all on the same page. We understand what the challenges are. It would be wonderful if we can use the time we have left for you all to talk, be prescriptive in terms of what you're doing or what needs to be done. I think we'll all gain so much from it. So Ruchika first, please.
Thank you. So I'd like to, I think a lot of what is being discussed, it really resonates with some of the work that we've been doing. And so I'd like to share 2 points from our ongoing work on climate change, health, and vulnerable settlements. And the first is really about how do we listen to people's experiences better and how that opens methodological openings for us for research and for practice. And the second is on thinking about climate change and heat more spatially and really in placing climate change in vulnerable settlements. Really thinking about where people live, where people work, and recognizing that across sectors of informal work, the geographies of economic work are different. So for example, where street vending happens is different to where waste work happens, where people live, where waste workers live may be different to where domestic workers live, and sort of paying attention to sort of the spatiality of work alongside this conversation, as well as where workers live. And so we've been doing a project called If Cities Could Speak, and that's really looking at the intersection of health and climate change in vulnerable settlements across India, Kenya, South Africa, Sierra Leone. And we've recently closed fieldwork, and we've done over 150 health histories across the seasons in 21 settlements, going to the same household through the seasons. And what we've been learning is that there is a vocabulary for climate change on the ground. It may often differ from the discourse that translates into technical vocabularies, right? So, and so coming to the point of the language that moves a scientist to really explore a subject, it's often very different to the language that really translates into policy and action. And so we've been really paying attention to what is that language on the field. And we're finding that there are 3 salient themes that keep coming up again and again. And people really talk about climate change through their lived experience, and their vulnerability shapes the way they talk about climate change. So people talk about infrastructure and services, they talk about their bodies, and they talk about livelihoods. And I'll give an example. So if you think about one of the households that we've been visiting, one of our respondents, she's a home-based worker. Her husband's a construction worker. Her son does Zomato deliveries. And so in the heat, when her husband is unable to work because of rashes and burns, and her son may be unwell, her work productivity also goes down, not only because there are gendered roles of care, but also spatially, the constraints of the home and the trade-offs that home-based workers have to make with where will you pull out that, the Silai ka machine in order to continue your work. So what we've been really repeatedly hearing is, loss of wages, economic loss, debt, people using their own body as metrics. So it was really interesting to see, the measurement of the symptoms that people have been reporting back to us. Ghabrahat, ghutan is this word that really haunts us, and so really thinking about what we've been really thinking about is using these three sort of themes to then say, okay, how do we intervene, and how do we intervene then from the site of vulnerable settlements? So thinking about vulnerable settlements as, looking beyond informal settlements, so looking at the Basti and the JJC for sure, but also looking at the resettlement colonies, where the state also creates vulnerability, looking at the way in which workers' homes agglomerate across different sites of work, and sort of paying attention to a scale that allows space for intervention and practice. So looking at this, so while I think one of the presentations was talking about variation across cities, but intra-city and neighborhood level differentials for heat. I'll stop here, but would be happy to share more, ahead.
Thank you, Ruchika. I just wanted to underscore the last point you made about the resettlement, that state-sponsored resettlement, right? At scale, there's so much in the Pradhan Mantri Awas Yojana that is yet to be built. And there's a great opportunity here to say, you have addressed sanitation, but what about ventilation and thermal comfort? And there's a lot of work for several of you that are in this space to sort of influence and continue to influence that. May I invite Arvind Uni to follow?
Yeah. Thank you. Happy to be here. I am going to be sharing some of the findings which are in line with whatever has been shared here also, but because we have to, I'll run through them quickly because I'm also sharing the findings on behalf of Shalini Sinha, who's not unfortunately here. Otherwise she'll ask me.
WeGo.
Yes.
Most of you know who Shalini is, but yes, it's for those of us.
So this is a study that we have done as WeGo. Firstly, of why we thought that we have to do this is to create a body of knowledge work to articulate what workers are facing, and not just from the perspective of mortality, because we know that it's the focus, but we also have to talk about what workers are going through, and the daily loss of livelihoods, working hours, money that they are going through. So that was the intent of how do we convert these anecdotal references, knowledges that exist to numbers, figures, so that we can act on them. The other reason why we thought it's very important that we work on this in the last, let's say, 2 years, is that 80%, 90%, the figure could be debated of what is the percentage of informal workers, but if you look at heat action plans are there, they have served a purpose. But if you look at heat action plans and how much of attention does it give to workers and informal workers, that constitute a majority of our work, our people. I would be surprised if more than 5 or 6 state action plans have even 2-page references or 2-page of content in a 100-page document to workers. So that is what prompted us to really join in this effort to articulate what is, and with evidence back up some of the concerns that workers are going through and has to be made part of heat action plans. So the first effort was with home-based workers. Like we all know that most of the home-based workers are women workers. This is 23 or 25% of women workforce is engaged in home-based work. So essentially it's money, it's livelihoods, and it's contributing to the economy. So which should be like a easier way to get acting on this. But unfortunately, home-based work is not recognized, unlike, let's say, street vendors. It doesn't count as work. Workplace, home as a workplace is still not recognized. There are references in policy, but it's not there. So that was the reason we thought it's very important to bring this into discussion. The methodology is very interesting. We did one survey before heat waves last year, after heat last year, I won't say heat wave. 300 home-based workers were surveyed. I'll quickly run through the survey. 8 out of 10, out of the 300, 80% mentioned that they're having to reduce, their working hours are reducing. 9 out of 10 reported that for the same work that they did, now they have to do more work to wrap up the same amount of home-based work that they are doing at home. 8.5 or 85% rather, I should stick to the percentage, are paying extra to keep cool, which means electricity, coolers, so on and so forth. This is translating into 2 out of 3, almost 75% reporting that they are eating less or their family is eating less, connects to what you were saying. And this is a bunch where they reported that they are earning 5,000 rupees a month. 5,000 rupees a month. So you can imagine of if there is even a little fluctuation, how much of impact does it cost? And the fact that you are consuming less in heat, during heat, and working more translates to, everything that you've heard from a health perspective. That's home-based workers, women home-based workers, and there would be at least 4 crore. I mean, 4 crore is 40 million? 40. Perfect, great. Yeah, just for the, yeah. And this is also because of a lot of built form environment of where they are, the kind of housing that they're in, could be easily incrementally developed, improved, but that is a language that we don't have right now because we are now scaling things up in the form of doing constructions at a higher scale and level in the form of different schemes which do not talk about heat. Very quickly again on street vendors, 96% said that they are expecting drop in customers. 90% said that they are experiencing reduced incomes. 75% are saying that stock is getting lost or we are losing stock. 12 out of 17 market sites that we studied for 500 street vendors, 12 have toilets, the rest don't. So it's up to imagination of where are they accessing toilets, and women street vendors again face this more. 0 out of 17 street vendor locations have water. So how do you expect to deal with heat waves when you don't have water to drink nor consume and serve the people? So there is the other thing that we noticed that I've said this elsewhere as well, that some street vendors are paying 9,000 rupees to cook, clean dishes. I mean, they are food street vendors. They are paying 9,000 rupees a month, roughly translating to 300 rupees a day for water. Whereas some people like me, when I was in Delhi, I was paying 0 because my consumption was less than the 200 liters per day, which is allowed. So this is extractive sort of system. I mean, you can't call it even exploitation, that they are working more, they are paying much more in terms of the rate that in comparison to anyone else. This is pure exploitation, extraction to a degree. I don't know what is a better term to put it. So here, it was also documented that street vendors face more eviction in summers and during heat waves because they put up tripal. And they say कि जैसे हम tripal लगाते हैं, हम पे कार्रवाई होती है because Street Vendor Act recognizes street vending, but it doesn't recognize right to shade. So if right to shade is not there and they put up something, they become encroachment and so on and so forth. So here, quick recommendations and what we can do on this, because that's the focus of why we are all here, is that look, outdoor, indoor, I mean in between, it doesn't really matter because outdoor sometimes is better than indoor for home-based workers, and many home-based workers sit at the doorway and do their work. So here the concern is that there are more than 400 types of workers which are there recognized or studied in the eShram. We need to think of how do we plan for a lot of them very specifically. Otherwise, generality of vulnerable population, outdoor worker, indoor worker is not going to work. So the fact that we'll have to actually sit down and get down to work and do this sector by sector, point 1. Point 2, that this is, of course, it's a health emergency, so on and so forth. But the fact that, look, a lot of this is context, a lot of this is the fact that there is no services, fact that there is no water. How are you going to deal with heat if you don't have water? So how do we take the basic services and improve that and resource some of the attention there? Last, couple more points. Extractive governance, I mentioned. So when we are looking at this imagination that workers will co-govern, so on and so forth, I mean, we are living in a fancy world. not the reality. So what needs to flip, I don't know, but the fact that we are extracting much more from the poorest and the most marginal and vulnerable has to be said, has to be recognized, and has to be fixed in heat action plans to some degree. But let's see how we do that. Policy, labor, like he's not there, Yogi's not there, but labor, OSH, urban planning, these are ministries that are not like into the game even. This is a good document. We got it after a lot of struggle last year. 4 pages, has some ideas. Can this be pushed by NDMA and folks here into heat action plans? Because a lot of our folks are drafting heat action plans. Can this be pushed to ministries and chief ministers, since they are the ones who are leading the show and pushing and getting things done? Can this be sent by NDMA to those to chief ministers and their secretaries to get this implemented and convert this into more context specific guidelines which suit their city or state? Has to be done. Otherwise, this will remain here. Last, actually, 2 points. One is that look, I don't know how do we do it. Gender is a big gap. Again, heat action plans talk nothing much about gender. I can straight away say that. So we have to create some framework for that. But caste, increasingly, why do you think gig workers are not offered water? Why do we have separate lifts for gig workers? Why is that gig workers or any worker is not allowed entry into a mall or a public space or a metro? I mean, this is discrimination working in a contemporary way to keep people out. So this connects to the last point, is that let's say actions like it's good that it's there, the Chennai model of shelter. How many shelters are we going to make? I was checking how much does it cost. It costs 25 lakhs. So how do we, yes, maybe that's important, but it's 25 lakhs. Do we have that kind of bandwidth? So we can do that, but public spaces need to open, parks need to open, for God's sake. And so what are the simple ways of dealing with this, and then working around to make a more actionable sort of framework, and then get down to implementation. And Sasta Sundar Tikau, not 25 lakhs, 10 lakhs, 50 lakhs. Sasta Sundar Tikau is what we kind of believe in, could easily be replicated and scaled up. So that would be the recommendations.
Thank you. I really regret that we don't have another half a day. I feel like we're just getting started. Arvind's got us, going. Here are the names that are left, and we want to leave a little time for Sujata ma'am to conclude and sort of provide some guideposts. So we have both Purvi and Tamanna from SFC, is that correct? And Dr. Sandol and CG are left, so that's 4. I'm going to request you to bear the cross of going last, and then always be the ones whose time gets a little constrained, and it is not fair, but the world is not fair. And before I go there, Suma should follow what Arvind said, because she's an old hat at this, and will have is sort of a natural concept. So Suma, so you're next, and then SFC, and then finally Dr. Sandal and Siji. So we have a lot of folks. So if I could just request you all to be very brief with your remarks, please.
Thank you. I'll be very quick. And what comes through this discussion, with Seva, with what Salahuddin has said, and when we are speaking of workers, it is impossible not to mention collectivism and collective bargaining. We say that gig workers are similar to all other outdoor workers. The challenge with gig workers is that algorithms and technology is used to direct and impede the rights that they have, the rights to collectivism as well. When we talk about data sharing, it is interesting that gig platforms have data of all their workers, consolidated work, data, but even governments do not have that consolidated data, neither do unions. So why should this data asymmetry be there? And this impacts collectivism because certain sort of, conversations, certain demands can be organically done. I remember that on December 31st, gig workers had this, no delivery, kind of a thing. And it organically spread, but that doesn't happen every time for every demand. And this led to governments, stopping the 15-minute or 10-minute delivery or whatever. So I think collectivism is something. So we talk about policy, we talk about developing guidelines, etc. But what gets workers their right is them asking for it. Again, just because we're talking about workers and informal workers, I'd like to mention the reluctance that a lot of policymakers, practitioners have to acknowledging unions as a legitimate actor in accessing those demands. Again, mentioning Noida, NCR, across India, the protests that have happened, that workers have, it was last week, 15 days back, and what we hear then, is that they're anti-national. So I think it's very important to be a facilitator so that these organized, protests can and continue to happen.
Thank you. Suma, I wasn't being flippant when I said it is unfortunate that we don't have time, because there's so much here to consolidate, and I feel like we're going to abruptly end when everyone finishes speaking, but there's very, very important points that are being raised, and for those who are taking notes, please feel free to share them with others or with Ritika if you would like, because there is a follow-up conversation that will be lost. It takes a lot of time and resources to get all these people together, and it would be nice to have some platform to continue where we're just getting started. Tamanna and Purvi, please.
Hi. So since we are already at 6:55 mark, I'll keep the comment really short. So a lot of it has already been said by Arvind, Sheikh, and Apekshita. What I'll limit my comment to is what can we expect from HAPS in today's world. So first of all, we're looking at occupational work site related regulations that already fall outside of the HAPS. But you have the labor departments who are mentioned sort of broadly in the HAPS that have to do a few things. First of all, we went to 9 cities, talked to many departments across these 9 cities, and found that what was done with respect to labor was the blanket sort of afternoon break, which I am assuming not a lot of workers want. The second part of it, which was not under the gambit of labor department specifically, was a few cities were actually putting up shade and water for the workers. So you're now looking at HAPS as not just instruments that do very targeted stuff. You're also looking at more system level sort of changes. For example, we found that health department was the one sort of who was doing a lot of stuff when it came to long-term heat action. And when you're looking at training all the future health practitioners around how to treat heat waves, you're also indirectly sort of benefiting all the workers who might go to them at some point. Similarly is the situation with other sort of limited long-term actions that are happening through or parallelly with the HAPS, which, as Arvind said and Adele said, which sort of has to deal with the city landscapes. So the way you plan your city, the way you build your houses, all of that, while in today's world HAP might not be mandating it as much, but in an ideal world you're looking at HAPs that will probably do that. The rest of it now comes outside the gambit of heat action plans in various sort of policies that already have legal backing as opposed to a HAP. So you're looking at Factory Act that mandates a certain level of threshold that has to be maintained. You're looking at other various policies for specific occupation that mandates employers to provide stuff like shade, water, rest breaks, etc. Now, I think I would leave here with the question, I think more specifically for Bhargav and Sachit. We are now having conversation, because science is great to come up with, right? We're now looking at conversations where Bhargav's study sort of validates what we've been saying for a long time, that we need local thresholds. But when we went to these 9 cities, one of the state actually had a university map out localized threshold for all the districts. But the district magistrate and all the districts are still getting the heat wave warnings from IMD. So you have to get out of a certain system that the cities are used to before coming up with these new things, and how do you integrate them? And I think similar is my question to Dr. Vegopal. When you're looking at WBGT sort of being the standard, so to say, how do we then integrate more sort of advanced version of the same in workplaces? This is also to do with what Alejandro sort of presented in the morning, where rather than fighting for perfection, we at this point should be okay with what is good enough. So I think my broader question is in terms of threshold. What is good enough for us to start with in India?
Yeah, hi. So I'm going to talk from the perspective of health, sort of health administrator, because my lines are tainted from working in the central government's health program on climate change and human health and health surveillance. So there was a question about surveillance, and I would like to say that since 2025, heat health surveillance captures some of the occupational related indicators in the surveillance, but because it's just 1 year old, the usefulness of that is very limited. And about integrating other indicators on occupational health is sort of very difficult, because as you know, in India, we don't still have electronic health records. So every effort to integrate a new indicator in the surveillance takes a lot of effort in the field to collect it and submit it. So those are the difficulties of health sector in capturing relevant data for occupations. And more than that, the data which is captured, the analytics of that is still very limited. So those are the limitations. And in continuation of the similar point, I would like to say that I'm seeing many field studies right now which are capturing actually health data, but they are not actually capturing heat-related illnesses in the right way. We just heard about heat stroke and heat exhaustion, and I would say that there are not correct case definitions that are captured in the study. So by relying on the self-report of symptoms and even diagnosis, assuming them to be the correct and linking all the summer-related health issues as a health-related illness is going to give us a very wrong picture of the health impact, and it actually misrepresents the health impact. So such methods also keep engagement of clinical and public health professionals relatively low, because you are not including them in them studies actually involved in a clinical judgment. So in discussion also they remain absent, and in turn it has led to not only neglect of the health sectors and health surveillance critical role in providing data and remaining the conversation for heat and health, but also led to insufficient attention to strengthening the capacity of health sector to respond to climate related health risk and deliver optimal care. And the second point I want to say, as very from the bird's eye view on the top of the health system, I would say that there is no doubt that the heat's impact on health on outdoor and indoor workers happens, particularly where the high physical activity combines with the inadequate cooling. However, the resulting vulnerability is less about heat itself, we all recognize that, and more about absence of basic safeguards. So while extreme heat may intensify this deficiency and drive the action, but our advocacy and responses must extend beyond seasonal and occupational subgroup specific intervention. For example, as a gig worker, rickshaw pullers, homeless population, watchmen, postmen, drivers, healthcare workers for that matter, actually go through similar physiological response and stress. So by focusing on one subgroup, I think we are missing the bigger picture and bigger implications and responses that we should actually mount without spending a lot of effort in actually establishing every time health impact and finding missing links in the responses. And so I would suggest that the field research should actually focus on upstream determinants of exposure and equitable access to cooling, especially long-term measures like blue and green spaces and the retrofitting of buildings, which many of us realize are very important long-term factors in surviving from heat. And yes, and thus in the heat health research also needs to shift from survey-based, very small term and very small sample size based, outcomes. It is useful, but as a scientific methodology, it offers limited depth for generating robust evidence, and it is more look like market research than actual health and public health research. So I will just say that we should be mindful about the time and resource that we use in coming up with the same evidence, and rather focus on implementation of things on the ground. Thank you.
Okay, Sachit, okay. Okay, Sachit, I'm going to follow what you suggested. I just prepared something else, forget about that, but I will tell you what we are doing. I am from Jansahas. We work with migrant workers in India and outside India, of course. So we have an engagement with almost like an 8 million migrant workers in India itself. But mostly we work on social security and worker protection. So the point I want to make is that 31% of the gig workers in India, they are internal migrants within India. And we know the kind of conditions that they live in, even if they are actually in gig. 8 of them may be in one room, and when they come back home, what is the situation, etc. Many of you have already shared. Now, what we do, what we have initiated, or last year what we did, and now what we are scaling, we have something called the cooling centers. So this time we have some 20 cooling centers where the gig workers and others can have a kind of drop-in centers to these places. Based on the NDMA guidelines, etc., but we have customized it for the gig workers and others across different cities in India. Then we have hydration in construction sites, I would say that, but in some of the construction sites that you would see, even in a 6-acre construction that is going on, there may be only 4 water points, and if there are 13-story building, but people coming down, and even basic necessities like the water is a huge challenge. So what we feel is that if there is a better hydration, there is going to be better resilience that is built. Then we had tried a parametric insurance product last year. This year we are doing it like a multi-peril insurance in the extreme heat context as well as in the excess rain or flood context, with almost like 10,000 migrant workers in India. This includes, like all types of migrant workers. Then PPE in the construction, and we are also trying to see in the gig as well. But one major challenge that we have experienced is that even if we have PPE kits meant for these, who will pay for it? And it is at the moment very, very expensive. And the last 2 points, we do believe as an organization that social protection definitely builds climate resilience in the context of any of these. For example, if there is an Ayushman Bharat that the individual has been registered to, but at the same time, the individual has been able to avail that facility in a particular location, that makes a big difference. And the last is the ground up, let's say centering the informal communities to the entire planning. So in Bangalore, with the Ward Climate Action Plan process with WRA and others, what we have tried to do is centering the informal workers like the migrant workers into the entire planning process, so that they are reasonably being adopted in the disaster planning as well as in the resilience engagement. So you must have heard Sheilaji talking about the resilient housing. This year we tried 70 resilient housing in worker colonies, because both are located, many of them in worker colonies are in a very challenging situations the workers are living. So and we did a study with gig workers. Later we shall share that with you, with over 1,000 sample size. Thank you so much.
And thank you for moderating your remarks to fit the time. Appreciate it. Dr. Sandal, you have the last word before I hand it over.
Thank you to be the last one, and I'll be very quick enough. I'll put 2 points here. One, a very cross-sectional survey coming out of 2,500 households with the support from NRDC. Although it was not targeted towards the gig workers, but it is a differentiation of heat adaptation measures in terms of inequality that we observed between indoor and outdoor environment. Let me put this forward, is that when we assessed about the access to the rehydration drinks, the indoor workers was really accessible as compared to the outdoor workers. Point number 1. Point number 2, when we switched that, the self-reported about understanding about the use of wet cloths. That's also a heat adaptation measure, but it is just the reverse. That means the outdoor workers has an access better than indoor workers, which was a bit odd striking finding to us as a scientist. So what I put the gap here is it is a kind of a knowledge gap or a policy advocacy gap that we need to think about it. Although I was expecting much about Bhargav's presentation and understanding about the threshold metrics, and that brings me to the support that what we are doing in the welcome trucks cool roof interventions. Although we understand the heat along with the humidity is a major index for thermal kind of a exposures metrics, but the study suggests that ventilation within the household is a major indicator understanding about the indoor air temperature. So that means even if the outdoor temperature goes down, the indoor temperature remains almost similar if the ventilation is not an appropriate words. And that makes the sense that the effect of this cumulative heat matrix to the understanding the physiological effect and as well as the psychosocial effect, because the sleep health is very least understood in terms of heat matrices. So probably shifting from the threshold metrics of environment to the physiological, psychosocial, including the sleep health metrics, probably a good way forward. I'll stop here. Thank you.
Note to end on. Professor Khosla and I are now going to demonstrate what coercion looks like. How many people here would not like to join a follow-up call?
After some time.
Who does not want to join a follow-up call?
After a break.
Please raise your hands. No, not today, not today. Many weeks from now.
It's not today, it's not tomorrow, it's not even this week.
Yeah. No, a few weeks from now. I think it's imperative to let this discussion hang at this point would be just very performative. So folks are okay, we'd like to propose that we'll take the responsibility for ensuring a follow-up conversation. I saw no hands raised, so thank you. Over to you.
I have the pleasant task of providing a closing summary of today's session. We spent an intense 2 hours plus discussing a very important issue. Fortunately for us, it was in a cold room. We had water to drink and our bodies were in resting phase. Of course, our minds were very active. Each one of you, the speakers, the presenters and the discussants have really added to the richness of the discussion here. And I feel that each one of us has something to carry back, and me in particular have benefited the most, I feel. Thank you all for being here. I just want to quickly reflect on a few things. The first point that comes out is that heat cannot be understood only through the lens of, what is the ambient temperature. It is to be experienced very differently depending on who you are, where you live, what work you do, and what kind of dwelling you inhabit. So given that the large number of people are living in very different circumstances, in very informal circumstances, as we have heard right from the morning session, heat and impact of heat is possibly very invisible and not equal on everyone. So that poses a big challenge. How do you address it in terms of policy? So the risks actually are hugely underestimated. What is reflected in an HAP is just covering the tip of the iceberg. It doesn't necessarily address the entire issue, which some of you have brought out. At the same time, may I add that the template for HAP is a copy-paste solution, and we need to now come up with a more detailed, but not too detailed. Now, we don't want something that needs many boxes to be ticked, but something that is more practical and covers all the different categories so that it is inclusive rather than exclusive. So what are the key takeaways that we have? We need to reduce the gap. We need to focus on solutions, and we need to be able to implement and execute with speed because of the urgency of the situation. I just want to bring out a few counterfactuals. So in the Mumbai Climate Week, which we had very recently in February in Mumbai, it was hosted by Project Mumbai. It's a non-governmental organization. It was supported by Government of Maharashtra, Environment Department as well as BMC. In that, Blinkit CEO had come, and she mentioned, you were there, right? Zomato was there, or was it Blinkit? Okay, Zomato CEO had come. Thank you. And she mentioned that they are providing a lot of rest areas, breaks, drinking water facilities, etc. for their workers. So that was something nice to hear. The other thing that I wanted to mention is about silos. If you were to really step back and think about all of us and what we are doing, there is silos even in this room. So much of the scientific findings that have come out or are coming out are not really shared within us. So I am very much in agreement with Sachit that we should do a follow-up call. Hopefully it can be done under the aegis of the newly set up Center of Excellence, which details will follow, I suppose, after the forum is over. And that could lead us to some sort of a road that takes us somewhere different from where we are today. The other thing that I wanted to mention was that there is progress. It's not as if nothing has happened. It's not so dismal, but we need to work on making sure that all elements and aspects of the problem are addressed adequately. And for that, I feel that over-regulation is probably not the solution, because we have had situations where India has not yet finalized its own Public Health Act. We also do not have things like Clinical Establishment Act, etc. So over-regulation, then a lot of other elements come up in protest, and then the whole exercise is defeated. So calling for more convergence of all organizations, agencies, institutions to provide a more coordinated response across sectors, some of which we discussed today. Labor, I feel, is one sector which is hugely underrepresented. And now we know that they have a very big share in this exercise. I would like to end on a positive note, which is that we are in the process of setting up a Center of Excellence in Nagpur, and hopefully it can help us all connect, collaborate, support, and execute at speed, as I said earlier. So please feel free to share some of your material which you could not because of lack of time today with Ritika. And I would like to really appreciate the NRDC team, which has worked so hard to put together such an exhaustive list of people, and for all of you to making time to be here today and share all of that. So in particular, I would like to appreciate Ritika Kapoor, who has been the anchor for this session, supported also by Abhiyan Tiwari and Anshima Mishra. These people have been working behind the scenes, so thank you so much to all of you, and once again, thank you all for joining us in this session.